Hi everyone, thank you for subscribing to my channel or listening to my presentations. I will be talking about crying baby today, and that is a big problem for many parents, particularly the mothers or some daycare centers. And the problem is common in kids that are less than or equal to 3 months, so in early months of life. Don't blame yourself. As a good mother, you've done your best, but the child is crying, particularly if you are young, okay? Teenage mothers, or you are new in the business. In other words, this is your first child. You've never raised any kid or kids in your life, so you are overwhelmed because this could lead to depression in you, and this could lead to anger, and some mothers or fathers will actually spank the baby, and that's going to lead to child abuse. Some kids will become maimed, from that, and so on and so forth. So some mothers will even develop postpartum depression just because of this. They've tried everything, they've checked the diaper, they've just fed the child, no rash, not hot, they've taken the thermometer, measured the temperature, they couldn't see anything anywhere, yet the child is fussy, the child is crying, the child is restless, and is even losing voice, hoarseness, exciting, all sort of things, right? Okay, I will give you now a lot of pieces of info, and we're going to arrive at conclusion together. Let's go. Okay, congratulations to the new mother, particularly those that are raising their first kids in life. So, infantile colic, that is in infants, when they start crying like that, that is going to be a big stress for both the mother and the new baby. Okay, but don't pin it on illness yet. It might be, but not yet. Let's go. And don't condemn yourself. You are not a bad parent. Okay? You're not a bad parent. You've not done anything horrible. That is, if truly you've not, anyway. The child will outgrow it. Okay? That's the good news. But today, you are suffering. Don't worry. It's going to be for a short time. It's common in infants within the first 1 to 3 months of life. They will cry because that's the only language they know. Of course, nowadays we've been hearing a lot of different, strange, mysterious stories about kids that are crying at 2 weeks, at 3 weeks, and I've never seen one watch on any video live, seeing or hearing a child of that age actually speaking, okay, clearly. Because the question is, how did they learn the language they're speaking? So the only language they know at this stage is to cry. Okay. Fussing, that is demanding or difficult child, will cry. Okay. Each parent determines what a normal or abnormal crying is. So it is subjective, kind of. There are some terms to be defined here. Some have defined colic, that is in a child that is an infant, and infantile colic is the query diagnosis in a child that is crying excessively for a longer period of time, then we'll weigh the following. As the child be crying for more than 3 hours per day and more than 3 days per week, and this child is less than 3 months old, because it's going to be better after 3 months. If the answers to all these three will be yes, then that is infantile colic. Firstborn and new parents will present more to doctors compared to others. That's what we call purple crying. Purple crying doesn't mean purple tears or the child will wear purple clothes or anything like that. Somebody is laughing. Let's get it right. It's in the morning. Okay. Purple crying means this is occurring in kids ages 2 to 12 weeks. The P will be that the child will be crying at the peak of it all. Okay. And U means it is an unexpected crime because the good mother has done everything. Yeah, the child is crying, and it's crying at the peak, has never been so loud like this before. Okay, and the R here is that you've done everything, but the child will resist soothing. You've done everything to soothe the situation for this child. You've changed the diaper, you pulled your powder, you changed the clothes, taking the temperature, not hot, not too cold. You fed, you breastfed, anything, whatever good you've done. Maybe dancing, rocking, and you've done everything. Yet the child is still crying, resist soothing. Eh? And the child will give a kind of appearance that's going to be pain-like. Okay? And this is going to be long-lasting for several hours. So it's going to be distressing, to the mothers, good ones, the concerned ones, and mostly at evenings or late afternoons. And you could see purple crying. I've painted all my info here purple. Okay. Cry fussy behavior. That is excessive crying, unsettled infant behavior. Some consider how loud or how pitch the voice is. Dysphonic could occur, that is hoarseness after straining the vocal cords. Now the child will cry on top of the voice. Ah! And at a point, become dysphonic. It's no longer coming out loud again and could become apatonic and inconsolable. So you've done everything, you pet, you sing, you rock, you've done everything. The child is not just responding to soothing. Epidemiology. 10 to 30% of all infants will have this problem. Okay? Few will meet colic criteria that I've stated earlier. You can go back to that and pause and read that. Less than 6 weeks old will have about 15 to 30% of them behaving like this. And the older they become, the lesser the problem. So less than 6 weeks old infants will behave like this, and 8 to 9 weeks old will have a 10 to 15% of them behaving like this. Why? When they grow up to about 12 weeks old, only 1% of them will have this problem. But take note of this. This is not the case of whether this is a boy or a girl. So there's no such relation or type of food or breast milk or not most of the time. But when we reach the causes, the possible causes, it might be cow milk issue, but that is just part of possible many causes. Okay, prenatal perception and experience is the key. So if you have been trained, if you have been educated that when you have the baby, you are likely going to face this, then the mothers and some good fathers who will stage to nurture the kids with their wives will both experience this together. But by the time we get to causes, I'll say some funny things, okay? Now, causes. In medicine, when we don't know the cause, we call it idiopathic. So, idiopathic, that's we don't know, but it's just occurring, right? Genetics. So this is where you're going to ask your partner if you are going to be honest with yourself. Your mom will be able to tell, and if your dad, if it was around when you were, 1 month, 2 months, 3 months old, will be able to tell that, hey, oh boy, you were like that. Or, oh girl, you were like that. That is, the father could be like that at that age. The mom could be like that at that age. So ask your parents-in-law about your partner. And of course, be honest with your own self so that you know there's no problem here. This is who I was at this age. Okay? I was like this when I was 2 months old. That was a story of a young man was talking to his own elder sister. Unfortunately for him, in the presence of his wife. This is a true life story. And the wife was complaining to the elder sister. I was there, was complaining to the elder sister that, oh, my child, oh my goodness, the pattern of crime was horrible. And my mom, that is the grandmother materna, was around to nurse the child, right? So the grandma materna was telling the couple, the husband and wife, that my own daughter was not like this, at this age. Do you know whether you were like this? And the young man said, I told them, never. I was quiet. And the other sister said, oh my goodness, who told you that? You were the cry baby, the worst of all of us. And the wife said, oh my gosh, I got it now. Then I came in to, settle the funny, not really rift, not misunderstanding per se. It was funny, but it makes it clear. And I told them many issues in medicine today could be traced to genes. So genetic constitution here. If this has never been on the list of causes in your literature, please insert that genetic influence. Okay, most of the time it's presumed to be related to gastrointestinal tract problem, and that is why we have the term colic. And it could be related to feeding issues like feeding technique, and the child is either hungry or overfed. Burping issues and burping infrequently could be a problem, and swallowing egg could be another cause. So what we do if burping is the issue is after feeding, put the child on your chest, rub the back until the child burps. Don't lay the child on anything, either the crib, the couch, or anywhere. No, not yet. Okay, other causes could be cow's milk intolerance because of possible allergy. So if you are just stop breastfeeding or you are not breastfeeding at all, which is not good anyway, I'm going to make separate presentation on breastfeeding later on. Okay, if you are just introducing your cow's milk, it might be your daughter or your son is not tolerating it because of allergy somewhere. This might be clearly lactose intolerance, okay? Or are we dealing with gastrointestinal tract immaturity here? Particularly, is this a preterm baby or a term baby? Preterm baby, term baby. Fermentation of unabsorbed carbohydrate will lead to excessive gas and intestinal hypermobility due to autonomic imbalance, that is increased sympathetic and decreased parasympathetic stimulation will lead to intestinal hypermobility. And eye calprotectin, that is a sign of high neutrophil infiltration, which is a big sign of ongoing inflammatory process along the gastrointestinal tract. So if we pick all this, that might be the reason why the child is crying. So because if there's inflammatory process going on internally and the intestine is misbehaving, or there's gastrointestinal tract immaturity and there's excess unabsorbed carbohydrates and the child is gassing, or this is just a newly introduced milk problem, cow milk to be precise, then the child will continue to cry. Other possible causes could be immature motor regulation, increased serotonin. Maybe the woman or the mother is breastfeeding and taking serotonin, and by the time you do the urinary 5-hydroxy-3-indoacetic acid level, that will determine or predict the level of serotonin. Nicotine exposure. Of course, somebody will be gisting somewhere in alcohol, a child be exposed to nicotine, the child cannot smoke. How about the mother or the father smoking around? Or the living caregiver you've just hired smoking, and maybe she's doing it in such a way that you never know, right? And possibly early form of migraine. There we go again. Ask family history of migraine in your partner, in yourself. Be honest with yourselves when it comes to this, because the children will pick from anybody. No, I mean from two families are meeting, right, to produce these new human beings, right? So they will inherit from not necessarily yourself alone, but your family generally. The child could pick anybody, could pick anything. So migraine in your family, the mother's family, the father's family, find out. It could be psychosocial issue like the temperament of the child. Like I said, who 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 was the mother like at this age? Who was the father like at this stage? Now, when the mom was 3 months old, when the father was 2 months old, okay? Hypersensitivity, family stress, family discord, so less time to pay attention on the child for all the needs or the daily cares, or young mothers or teenage mothers. Why? Why do I even need to talk about this? It's because they may be inexperienced and the child will keep crying, or they want to enjoy themselves, or the life has just changed. Teenage mothers, they didn't, or wanted babies. Now, they didn't plan for this. They've been partying, they have the way they spend their weekends. Suddenly something has changed. Somebody has joined. You can't just move the way you like, and they are not able to meet. So all this could be the reason why the child is crying, because the child is not getting the attention needed. Careless caregivers. I hate to say this, but that is the truth. Careless caregivers, you drop your child at daycare. You are even paying having some money on a monthly basis, maybe deducted directly from your salary or whatever, or you even hire somebody to be living in with you to look after your kids, and once you turn your back, things are done upside down, or not even done. That's why some will even install secret cameras to see what's going on at home. So careless caregivers, or frank child abuse. I had an experience in the past when a family hired a living caregiver, and the caregiver was given the freedom to cook and eat anything that the adults will eat, and then they bought artificial milk, expensive one, SMA Gold, SMA Progress, for their newborn. Okay, but when they turn it back, do you know what the caregiver did? Or will be doing? She did that for some time before she got caught, right? She will start leaking the powder and then make the watery one for the child. Hmm. What are the possible clinical features? Paroxysmal in nature. It's going to come sporadically. Now, it's not that the child is going to be crying all minutes, all seconds, all hours, every day. No. So it's going to come off and on and off, and so on like that. Qualitative, well, it's going to be louder, high pitched. The child becomes dysphonic at a point, hypertonic state, and difficult to console. Assessment. Okay, to the good mothers and the fathers that present at the clinic. I'm not saying those that will not present are bad, but those who do not have that experience and probably they've not listened to presentations like these, or they've not read stuff around us online, or they've not called their mom or their mother-in-laws or whatever, they will run to the hospital or to the clinic. So to the physicians, the first thing is history of this crime, the pattern of crime, history of feeding, any medication given to the child, or if this mother is breastfeeding, any medications that she is taking also. Okay? How about history of trauma in this child? As a matter of fact, we have to rule out child neglect and child abuse. I'm not scaring away mothers from presenting. If you're a good mother and you've done nothing wrong, I will present. Okay? Go. Okay? Ear discharge. We want to know whether there's otitis media, whether the child is pulling the air or not. In the other case, we're going to check for all signs of infection, including meningitis, social stressors in the family and around this woman. For example, a single mother, right? And young, no job. Okay? So, all those things to be put into consideration. We're going to have what is called physical examination. We're going to check that child from head down to toe. Okay? We're looking for signs of abuse, signs of meningitis, signs of fracture, signs of osteomyelitis, signs of urinary tract infection, and of course otitis media. We're going to check the tympanic membrane for bulging and so on. If it's a male child, it might be testicular torsion, and we're going to check for swelling and tenderness in that region, okay? And signs of ovarian torsion in a female child with possible abdominal distension, feeding intolerance, fuzziness, or irritability. Of course, we're going to check the inguinal region for signs of inguinal hernia, the signs of pyloric stenosis, projectile vomiting, mass, sausage-shaped mass, and so on. I'm going to search for that. How about gastroesophageal reflux disease? I'm going to ask for the history and examine. Signs of constipation. How about heart-related problems? I've just mentioned otitis media a while ago, and I'm going to see bulging tympanic membrane. Hypotonia, if there's central nervous system disorder or neuromuscular disease. And we'll check the fontanelle. If it is full, might be dealing with meningitis or trauma. And of course, low weight will give us the sign that this child is not being properly fed. So, history of feeding will have to be taken in details here. But we are not likely going to get the true history when it comes to neglect or abuse. It's going to be subjective. I mean that It depends on the physician who will be able to use his high level of index of suspicion to get it. Most times, those who abuse their children will present histories that will not tally with the physical examination. What are the possible outcomes? This can lead to child abuse because when a child is crying continuously, in fact, I think I've had some stories that are so horrible that will make you cringe. I'll just say one. A family left home for their kids, I would say. Two were older and one newborn. And the younger one, the newborn, was crying and crying and crying overnight. When the younger one that was crying and could not be consoled was disturbing the older ones, one of them kept beating the newborn till she gave up the ghost. Horrible to hear. The child was actually beaten to death. Not by the mother, not by the father, but by the inexperienced elder brother. Now, child to child now. You understand what I'm saying? Not an adult, but couldn't fathom why the child was crying and wanted the child to stop crying. Started spanking and beating and hitting till the child died. And to the mothers and fathers that are hot-tempered or could not cope or don't understand, could start hitting this child, and that will lead to child abuse. Can actually lead to death or permanent disability in some children. It's a serious issue. And sometimes to the kind-hearted mothers and fathers, there is the possibility of postpartum depression in the young and inexperienced mothers. Why? They want to help the child. They've done everything. But the child has never stopped crying. Then they become depressed and they start judging themselves. I'm a bad mother. I've not done well. No! Don't judge yourself. Don't rule yourself out. You're not bad. Okay? Get it right. You're not. Treatment. There is no treatment per se. We are just going to reassure you. But physicians should not be judgmental. Okay? In the course of everything, you can then give some pieces of advice. But before giving them pieces of advice, we have to treat any identified comorbidity. For example, through the history of physical examination, we could detect that this is meningitis. Man, instantly. Before I'm going to do any imaging, any laboratory investigation, I'll start my empirical antibiotics right away. Okay? And of course, I will not give ceftriaxone if this is newborn, 1 week, 2 weeks, 3 weeks, or neonates generally. I'm not going to give ceftriaxone. Don't worry, by the time I take the topic on neonatal meningitis, I'll tell you why. Encourage the mother, please. And of course, the father, if they both come, even sometimes it might be the father that will bring the child to the physician, right? Encourage the parents, preferably both. And then give some pieces of advice like feed on demand. No, you know when your child wakes up to eat, please give. Let your child bop. Play music. Turn on your vacuum. Remove or decrease other noise around. Okay? You can put your child in your van or car, hook up, in the car seat, and drive around the city. Okay? But, whatever, get big toys that can produce interesting sounds. I specifically said big toys. I'm not against tiny toys, but when it comes to foreign body aspiration in children, I'm not going to be a contributor, to such a big issue. So that's why I suggested big toys, teddy bear, those ones that could produce interesting sounds. I'm not advertising, I'm not helping, I'm not promoting teddy bear with, interesting sounds. I'm just telling you facts that will be helpful. Okay. In conclusion, don't worry, it's temporal. Don't condemn yourself. Don't beat that child. Don't be too annoying. If you are confused, call your mom. Call your mother-in-law. Call those seniors in your community. Call a friend who has raised 2 or 3 kids in the past, or even one, but in the past, older than your kids, right? Call your doctor. Call your doctor on phone. If you call me on phone, I will help you. No, 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 I'm not going to release my number online. Just kidding. It is well with you and your child. That's my desire, okay? But I would love it more that the problem should be jointly solved by the two parents. In other words, husbands, please stay with your wives. Don't leave them alone to face this stress. Because by the time the stress is too much on them and they go to depression, they become suicidal, either suicidal ideation, attempted suicide, or even frank suicide. And you'll not be happy. That's my assumption. You'll not be happy to see your wife being buried because she's raising your own child. So let's solve this problem together. Let's salvage it together. Let's get out of it together. Showing you it is temporal. With that, I've come to the end of this presentation. Kindly subscribe to my channel so that you can get my presentations immediately they are published. I appreciate it. You can leave comments for me at the comment section. Thank you. I appreciate it.